Hello, friends. I am Dr. Jagdish Hiremath, practicing cardiologist in Pune for many decades, actually. So, today we are going to see some of the newer developments in the management of systemic hypertension. It's a topic which is so common and so apparently balanced, but newer things keep coming, and it's a nice way to update ourselves so that we don't have to read too much, get the one liners from most of the trials, and then probably we are done for a few months at least. In India, once upon a time, it was said that the prevalence of hypertension is about 33%, but now it has gone up to almost 38% in men and 32% in women. So obviously, there is a rise in prevalence of hypertension. Any three individuals who meet, one of them could be a hypertensive individual, and this has appeared in Lancet of 2021. The ISH, International Society of Hypertension, released a global hypertension practice guideline. There were two words in it: optimal and essential treatment paradigms. Optimal means an evidence based standard of care, and essential means a minimum standard that has to be offered. Suppose you are not in a very good place, requirement of the availability of medicines is not too good, but despite that, you must achieve a level of 140/90. That is called as the essential care. And optimal is when you have all the facilities, you will go down actually to the guideline directed goals which are set. Of course, many guidelines keep coming. One of the important changes that happened in 2021 in ACC/AHA guidelines is if somebody is a low risk individual and has stage 1 hypertension, if somebody is sitting on, say, 140/90, then it's prudent to start him not on medication, but just non pharmacotherapy like control of salt, control of weight, aerobic exercises, DASH diet, and maybe relaxation techniques. With this, most of them would be controlled, but at the end of 6 months, if the blood pressure, despite a good lifestyle, is sitting on 140/90, then you can consider a pharmacotherapy. This has appeared in Journal of Hypertension in 2021. ARDS. ARD is a potentially fatal condition involving the lung damage, and experts often associated with the severe COVID-19 these days. A recent study showed that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19, including complications like ARDS. Normally, we don't use beta blockers in respiratory conditions, but here is a paper appearing in Journal of American College of Cardiology in September, which deals with this aspect of metoprolol being useful in ARDS related to COVID. Lowering blood pressure targets down to 110, that is extremely well controlled systolic hypertension, is shown to have bigger benefits in the STEP randomized trial, which is a Chinese trial, and the results are similar to what Sprint showed us some years ago. Almost 8,500 patients, age group 60 to 80 in China. The intensive target trimmed 26% of the composite CV risk. Finding from now a second major trial supporting the lower targets could be helpful to patients. So this has appeared in the the NEJM Medical Journal 2021. So wherever possible, control your blood pressures to 120 or below, of course, provided there are no symptoms of postural hypotension. With regards to the prognostic value of ambulatory blood pressure monitoring, nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on the office blood pressure, but also on the out of office measurements such as ABPM or home blood pressure monitoring. And it generally shows that every 20 by 10 millimeters of mercury increment in the BP measurement at night, the risk of mortality increased by 23%, indicating thereby that night blood pressure is an important parameter looking at the cardiovascular complications of this individual. 2018 European guidelines also talked about compliance as one of the major risk factors. Just as we talk of diabetes or high cholesterol or smoking as major risk factor, If somebody deserves treatment and doesn't take blood pressure treatment, it also becomes a major risk factor. So we have to write prescriptions which are compliance friendly, that is maybe a less number of tablets, fixed dose combinations, of course, pocket friendly prescriptions. All this will help in improving compliance of these medication. Valsartan came under a lot of cloud in 2018, and a particular batch of Chinese made valsartan was withdrawn from all over the world related to carcinogenic properties. This, of course, needs more discussion. Fortunately, we don't face such a problem here in India, but it will be discussed in the years to come. That ARBs and their propensity to produce new carcinogenic properties in human body. Hygia study represents a largest study that tested nighttime antihypertensive treatment. There has been a debate going on whether morning medicine for hypertension would be better or night, especially when we are going to give one tablet. Stands to logic that by giving at night, you are producing a physiological dipping in that individual, controlling the nighttime blood pressure, and also controlling the early morning surge better. This Hygia study is the largest study, included almost 19,000 hypertensive patients, and with an average follow of 6.3 years. An ambulatory BP measurement was performed for 48 hours, and the data collected showed that nighttime dosing of antihypertensives significantly improved the nighttime treatment when compared to awake treatment. In fact, the doses that we use of hydrochlorothiazide or chlorthalidone, the antihypertensive diuretics or indapamide, are so small that don't be shy of using them at night if it fits into your prescription pattern better. All in all, we all must know that we should treat blood pressure very well, a common disease which has a very long daily life. That means person suffers it for decades, and those loss of life is also possible because of that. We must bring in some Indian perspective to it, that all of us Indians have very high sympathetic tone shown by a very large study of almost 20,000 people. So our use of beta blocker as one of the prime time antihypertensive medication should be thought of if you find that the person has high sympathetic tone like high blood pressure and other things. All in all, these updates I'm sure will help you as one line pointers towards improvement in your treatment of hypertension. Thank you.